Hello, my name is Dr. Anamika Joshi. I'm an oculoplasty specialist. That means I'm an eye plastic surgeon. And today I'm going to answer a very important question that my patients ask me, that does artificial eye surgery have any chances of damaging the other eye? Now, there are a lot of patients who have lost their eye in some sort of accident or some infection or some cancer. And apart from the vision that they have lost, the eye also looks very disfigured. It can look whitish, it can look small or bigger and very odd, which makes the appearance of the entire face abnormal. How do we treat that? We do artificial eye surgery for it, which doesn't bring the vision back, but it completely transforms the face and the cosmesis of the eyes and makes that disfigured eye after the surgery look very similar to the other eye. But a common fear that I see in the patients, or the common question that they ask me is, will any surgery done to the disfigured blind eye cause any problem to the normal eye? So the answer to that is no. Any surgery done on the disfigured blind eye can never cause vision issues or any sort of issues to your normal eye. Please try to understand that these two eyes are not really connected anatomically where you're seeing it. There is a structure of bone, nose, everything in between. Now, there are nerves behind the eye which go on for 50 mm behind, and that's where they are connected. 50 mm is a very long distance. Now, what do we do in artificial eye surgery? We are not touching the nerve at all. We only remove the contents of the eyeball. The entire eyeball itself is around 24 mm. So we are not even touching the nerve. So we preserve the sclera, the white part that you can see, and we only remove the contents of the eyeball. We put an implant inside and we preserve the muscles. We don't even touch the nerve usually. So this surgery is evisceration surgery. So there is absolutely no chance that this can have any impact onto the other eye, right? So even in your consent or nowhere it will be mentioned that anything can happen to your other eye. So don't keep that fear in your mind. And I hope that with my explanation, you've understood that it's impossible to cause any damage to the other eye. In fact, there are some conditions in which it is advisable to remove the disfigured eye to prevent any problem to the other eye in cases of trauma, etc. So you have to understand that removing this eye absolutely is an independent thing and has no effect on the other side of the face or the other eye. A lot of patients, because of this fear, they haven't opted for this surgery. And I can tell you, patients who have done it are so happy. Their entire face is transformed. Their eye looks so normal after this surgery. So don't let this baseless fear stop you from proceeding with this surgery. I hope this helps. And in case if you have a disfigured blind eye and it's really affecting your confidence, you can consult an oculoplasty specialist, or you could consult us. You can call on this number. I also offer online video consultations. You can go on my Instagram where I give regular updates about the same surgery. So I hope this helps.